Hi all, myself Paul from SNS College of Physiotherapy. Today I present my case on the right tennis elbow. So he's a male patient. So he had a complaint, came with a complaint of right side elbow pain for past 1 week. So his occupation is IT worker, and also he did not have any past medical history, and also in on observation. So first we can see about the pain. So pain history. First side. So side is on the lateral aspect of the elbow. So this is the side of the pain, and side is right side elbow. And also he had a pain. Type of pain is dull aching pain, and also he had an aggravating pain when he does on the wrist extension. So when he do a wrist extension, he had feel a pain, and also relieving pain is rest or any taking medication. So he had this is a pain history, and on observation it's a normal body build, and also he does not have any deformity, and swelling is not present, and also redness is also not present. In on palpation we have feel warmth on the lateral aspect of the elbow in the right side, but in the left side he had no warmth. So he had a warmth present, and also tenderness. So I touched this pain place. So he had a pain. So there has a tenderness like a grade 2, and also muscle tone is a normal tone on muscle palpation. And on examination we first see about a muscle tone. So muscle tone we have a grade 2 plus only. So I do a elbow flexion and wrist flexion and extension. I feel a grade 2. That's a normal response. And also muscle power. So I do a wrist extension. So he does a wrist extension, but he had normal movement. So that's a muscle power 3. But I give a little resistance. He do wrist extension. So he has the pain feel. So he have a 4 plus, and range of motion is normal. So elbow range of motion is also normal, and wrist range of motion is also normal. So next we can see about a special test for a tennis elbow. We have Cosen's test and Mills test. In Cosen's test, the patient in on the elbow extension and all fist the hand. So I give a patients can do I tell to do wrist extension, but I resist the wrist extension. So that time patient can feel in the elbow side. So do the wrist extension. So that time he feel on the lateral side of the elbow. So this is a positive for the tennis elbow. And Mills test. So these tests is done by the only therapist passively. So first we can flex the wrist. So next pronation the forearm and do the elbow extension. So that time we can feel the patient in the lateral aspect of the elbow. So this test is also positive. So Mills test for tennis elbow. So these both tests is considered as the special test for the tennis elbow. So next we can see about the treatment. So what are the treatment we can done for the tennis elbow? First we can check the any muscle tightness. So in this condition we have the wrist extensor tightness. So first we can release the tightness of the wrist extensors. So like muscle release the muscle tension. So in the ischemic compression. So that treatment will be done. Next we can move up the therapeutic modalities. So first ultrasound, that's 3 megahertz will be used to treat the tennis elbow. So that ultrasound 3 megahertz for 8 minutes only. And with any ointment or any drugs we can use with the ultrasound, that is a phonophoresis, that also given for the 8 minutes. And we can next therapeutic modalities like use the TENS So TENS we can use plain TENS or surge TENS. We can only apply for 15 minutes. So place a electrode, one electrode placed in the lateral aspect of the forearm, another below the lateral aspect of the forearm. So these treatments are given for 15 minutes. So these are the therapeutic modalities we can use for the tennis elbow. Next we can move on the exercise. So in exercise mainly concentrate in the wrist extensor to stretch that muscle. So we can do that Mills test, so also called Mills manual. So that test we can do with the treatment that is called Mills manual. So we can fist the hand and flex and extend the elbow. So you can stretch the extensor, wrist extensor muscles. So this is the Mills manual also. That's all. So next home program like hard pack application and stretching exercise and or strengthening exercise with the therapeutic bands. These treatments are also given to the tennis elbow. Thank you.